In this video, we will explore the top 25 Band 7 nurse interview questions and provide comprehensive answers to help you prepare effectively. Whether you're new to the job market or looking to advance, these insights will enhance your confidence. 1. How would you describe your leadership style and how do you adapt it to different situations? My leadership style is collaborative and adaptive. I believe in empowering my team by fostering open communication and encouraging diverse perspectives. In dynamic situations, I assess the team's strengths and needs, adjusting my approach accordingly. For example, during high-pressure projects, I take on a more directive role to ensure clarity and focus. Conversely, in stable environments, I promote autonomy, allowing team members to take initiative and ownership of their tasks. This flexibility helps me respond effectively to varying challenges while maintaining a motivated and cohesive team. 2. Tell us about a time when you successfully led a team through a challenging project or change initiative. In my previous role, I led a team tasked with implementing a new electronic health record system. The transition faced resistance due to concerns about workflow disruptions. I organized a series of training sessions, actively involved team members in decision-making, and created a feedback loop to address concerns promptly. By fostering open communication and encouraging collaboration, we successfully rolled out the system ahead of schedule, improving efficiency and enhancing data accuracy. This experience reinforced the importance of adaptability and support in guiding a team through change. 3. How do you motivate and inspire your team members to perform at their best? Creating an environment that fosters motivation starts with clear communication of goals and expectations. I regularly recognize individual and team achievements, which boosts morale. Providing opportunities for professional development allows team members to enhance their skills and feel valued. Additionally, I encourage an open-door policy where team members can share their ideas and concerns, making them feel heard and empowered. By cultivating a culture of trust and collaboration, I inspire my team to take ownership of their work, leading to improved performance and satisfaction. 4. Describe your approach to performance management and how you handle underperforming staff. My approach to performance management focuses on setting clear expectations and fostering open communication. Regular feedback sessions and performance reviews allow me to assess individual contributions and identify areas for improvement. When dealing with underperforming staff, I prioritize understanding the root causes of their challenges. I provide support through coaching and tailored development plans, encouraging them to set achievable goals. This collaborative approach empowers staff to take ownership of their performance while creating a culture of accountability and continuous improvement. 5. How do you ensure effective communication within your team and with other departments? Effective communication is vital to team success. I prioritize regular team meetings where we discuss ongoing projects, share updates, and address any concerns. I encourage an open-door policy, allowing team members to approach me anytime with questions or suggestions. To facilitate interdepartmental communication, I establish clear channels, such as scheduled joint meetings and collaborative platforms, ensuring everyone is aligned on goals. Additionally, I emphasize active listening, which fosters trust and encourages team members to voice their ideas and feedback, creating a more cohesive working environment. 6. How do you stay updated with the latest developments in your clinical specialty? Staying updated with the latest developments in my clinical specialty involves a multifaceted approach. I regularly read peer-reviewed journals and subscribe to relevant medical newsletters to keep abreast of new research findings. Attending conferences and workshops allows for networking and learning directly from experts in the field. Additionally, I participate in online forums and professional groups where current topics are discussed. Engaging with colleagues and sharing insights also enhances my knowledge and ensures that I remain informed about best practices and innovations in patient care. 7. Describe a situation where you implemented evidence-based practice to improve patient outcomes. In a recent clinical setting, I noticed a high rate of post-operative infections among patients. I led a team to review current practices and identified areas for improvement. We adopted an evidence-based guideline focusing on enhanced sterile techniques and post-operative care protocols. After training the staff, we implemented these changes, monitored infection rates closely, and adjusted our practices as needed. Within 3 months, we observed a significant reduction in infection rates, enhancing patient recovery and satisfaction, demonstrating the value of evidence-based practices in clinical settings. 8. How do you ensure high standards of patient care are consistently maintained in your area? To ensure high standards of patient care, I prioritize a culture of accountability and continuous improvement within my team. Regular training sessions and workshops are essential for keeping everyone updated on best practices and new protocols. I emphasize open communication, encouraging team members to voice concerns or suggest improvements. Regular audits of patient care processes help identify areas for enhancement. Additionally, I engage with patients to gather feedback, ensuring their needs and expectations are met while fostering a patient-centered approach. 9. Tell us about a time when you had to manage a complex clinical case. What was your approach? In a recent case, I managed a patient with multiple comorbidities requiring a multidisciplinary approach. I initiated a case conference involving specialists from different fields to ensure comprehensive care. Each team member contributed insights on their specialty, allowing us to create a tailored care plan. Regular follow-ups were scheduled to monitor progress and adjust the plan as needed. Effective communication with the patient's family was maintained throughout, keeping them informed and involved in decision-making. This collaborative effort led to improved patient outcomes and satisfaction. 10. How do you promote patient safety and quality improvement in your daily practice? In my daily practice, I prioritize patient safety by fostering an environment where staff feel comfortable reporting incidents and near misses without fear of retribution. Regular team meetings are held to discuss safety protocols and review case studies that highlight best practices. Additionally, I implement checklists and standardized procedures that reduce the risk of errors. Continuous education and training sessions for staff ensure that everyone is updated on safety measures. I also encourage interdisciplinary collaboration to identify quality improvement opportunities, ensuring comprehensive patient care and safety. 11. How would you go about identifying areas for service improvement in your department? Identifying areas for service improvement involves a systematic approach. First, I would gather feedback from staff and patients to understand their experiences and identify pain points. Conducting regular audits and data analysis can highlight trends and inform decisions. Engaging the team in brainstorming sessions encourages collaboration and innovation. I would also review existing policies and compare them against best practices in the industry. Prioritizing improvements based on impact and feasibility ensures that efforts yield meaningful results, fostering a culture of continuous enhancement in our services. 12. Describe a time when you successfully implemented a new policy or procedure. What was your approach? In my previous role, I led the implementation of a new electronic health record (EHR) system. Initially, I conducted a thorough needs assessment to identify areas for improvement and gathered input from staff to ensure the system met their needs. I organized training sessions that were tailored to different user groups, allowing everyone to feel comfortable with the transition. Regular feedback was encouraged, and I established a support line for questions during the initial rollout. This approach fostered collaboration and ensured a smoother change process, ultimately enhancing efficiency in patient documentation. 13. How do you balance the need for efficiency with maintaining high-quality care? Balancing efficiency with high-quality care involves prioritizing processes that enhance productivity while never compromising patient outcomes. Regularly assessing workflows helps identify areas for improvement, such as minimizing unnecessary steps or streamlining documentation. Engaging the team in discussions about best practices fosters a culture where efficiency is valued alongside care quality. Implementing technology solutions, like electronic health records, can reduce administrative burdens, allowing more time for patient interaction. Continuous training ensures staff are equipped with the latest skills needed for delivering exceptional care efficiently. 14. What strategies would you employ to improve patient satisfaction in your area? Improving patient satisfaction involves several strategies. First, I would prioritize communication by ensuring staff actively listen to patient concerns and provide timely updates regarding their care. Implementing regular feedback mechanisms, such as surveys and suggestion boxes, would help identify specific areas for improvement. Additionally, I would focus on staff training to enhance interpersonal skills and empathy. Creating a welcoming environment and ensuring that patients feel valued and respected can significantly boost satisfaction levels, alongside addressing any complaints promptly and effectively. 15. How do you approach resource management to ensure optimal use of staff and equipment? Effective resource management involves thorough planning and regular assessment of staff and equipment needs. I prioritize understanding team strengths and weaknesses, aligning tasks accordingly to maximize efficiency. Implementing flexible scheduling allows for adaptation to fluctuating demands, ensuring that resources are available when needed. Regular training sessions enhance staff skills, optimizing equipment use. Additionally, maintaining open communication fosters a collaborative environment where team members can voice concerns or suggest improvements, contributing to a more efficient workflow. 16. How do you support the professional development of your team members? Supporting the professional development of my team members involves creating individualized development plans that align with their career goals and the needs of our department. I encourage continuous learning through regular training sessions, workshops, and access to online resources. I also promote mentorship opportunities, allowing experienced staff to guide less experienced colleagues. Regular feedback sessions are essential for discussing progress and identifying areas for improvement. By fostering an environment of open communication and recognizing achievements, I empower my team to pursue their professional aspirations effectively. 17. Describe your experience in mentoring or coaching junior staff. Mentoring junior staff has been a rewarding aspect of my career. I focus on creating a supportive environment where they feel comfortable asking questions and expressing concerns. I've developed structured mentorship programs that include regular one-on-one meetings, skill assessments, and personalized development plans. By setting clear goals and providing constructive feedback, I help them build confidence and competence in their roles. Celebrating their achievements, no matter how small, fosters a culture of growth and encourages continuous learning among the team. 18. How do you promote a culture of continuous learning and improvement in your team? Promoting a culture of continuous learning and improvement involves creating an environment where team members feel encouraged to seek knowledge and develop their skills. I implement regular training sessions and workshops that focus on both clinical and leadership skills. Encouraging collaborative discussions allows team members to share insights and best practices. I also emphasize the importance of feedback, fostering an atmosphere where constructive criticism is welcomed. By celebrating small wins and recognizing individual and team achievements, I motivate my team to pursue personal growth and excellence in patient care. 19. Tell us about a time when you had to manage a difficult learning situation with a team member. When I encountered a team member struggling with new protocols, I scheduled a one-on-one meeting to discuss their challenges. I listened actively, ensuring they felt heard and supported. Together, we identified specific areas for improvement and developed a tailored training plan. I also paired them with a more experienced colleague for mentorship. Through regular check-ins, I provided feedback and encouraged questions. This approach not only helped the team member gain confidence but also fostered a collaborative environment, enhancing team cohesion and performance. 20. How do you keep your own professional skills and knowledge up to date? Keeping my professional skills and knowledge current involves a multifaceted approach. I regularly attend workshops, conferences, and webinars relevant to my field, which provide insights into the latest practices and innovations. Engaging in peer discussions and networking with colleagues allows me to exchange valuable information and experiences. I also subscribe to reputable journals and follow industry leaders on various platforms. Additionally, I participate in online courses to enhance specific skills and ensure my practice aligns with evolving standards and guidelines. 21. How do you ensure that your team adheres to NHS values and policies in their daily work? Ensuring adherence to NHS values and policies involves regular training and clear communication. I prioritize creating a culture where these values are embedded in everyday practice. I hold team meetings to discuss NHS policies, encouraging input and questions. Regular performance reviews help align individual goals with organizational values. I also lead by example, demonstrating commitment to these principles in my actions. Feedback from staff on challenges they face in adhering to policies allows me to address issues proactively and facilitate continuous improvement. 22. Describe a situation where you had to deal with an ethical dilemma. How did you handle it? In a previous role, I encountered a situation where a patient required a treatment that was not fully supported by clinical guidelines due to limited evidence. The patient's family was insistent on proceeding, believing it was their only hope. I facilitated a discussion with the healthcare team, weighing the potential risks and benefits. Ultimately, I arranged a meeting with the family to transparently discuss the uncertainties involved. Together, we explored alternative options while ensuring the patient's wishes and safety were prioritized, leading to a collaborative decision that respected everyone's values. 23. How do you promote equality, diversity, and inclusion in your workplace? Promoting equality, diversity, and inclusion in the workplace involves implementing a range of strategies. Firstly, I ensure that recruitment processes are fair and transparent, actively seeking diverse candidates. Secondly, I conduct regular training sessions to raise awareness about unconscious biases and the importance of inclusivity. Additionally, I create a supportive environment where all team members feel valued and empowered to share their perspectives. Regular feedback mechanisms help identify areas for improvement, allowing us to adapt our practices to better support diversity and inclusion initiatives. 24. What is your understanding of clinical governance and how do you apply it in your role? Clinical governance refers to the framework through which healthcare organizations ensure high standards of care and continuous improvement in patient outcomes. It encompasses various components such as risk management, clinical audit, and patient safety. In my role, I actively engage in regular audits to assess service quality and identify areas for improvement. I also ensure that my team is trained in best practices and adhere to established protocols. By fostering open communication, we can discuss incidents and learn from them, cultivating a culture of accountability and excellence in patient care. 25. How do you ensure that your department complies with relevant healthcare regulations and standards? To ensure compliance with relevant healthcare regulations and standards, I implement a robust framework that includes regular training sessions for staff on current policies. Regular audits and assessments are conducted to identify any gaps in compliance. I foster open communication, encouraging team members to report concerns or seek clarification on regulations. Collaborating with quality assurance teams helps maintain alignment with best practices. Additionally, I stay informed about changes in legislation and guidelines, ensuring our procedures are always up to date and reflective of the latest standards. Remember, preparation is key to success, so take the time to practice your responses. If you found this content helpful, please give us a like and consider subscribing for more valuable insights and tips. Your support encourages us to create more content that helps you achieve your career goals. Thank you for watching.